Hello, future nurses. Welcome back to the Rising Nurses Next Generation. In today's session, we will cover 20 objective type and SATA. Select all that apply. Questions on myocardial infarction. These NCLEX style practice questions will help you revise pathophysiology, signs and symptoms in nursing intervention and priority care for myocardial infection. Let's test your knowledge and boost your confidence. We move on. First question. The most common cause of myocardial infarction is option A coronary artery spasm, option B atherosclerotic plaque rupture, option C hypertension, option D pulmonary embolism. Correct answer is atherosclerotic plaque rupture. MI usually results from rupture of an atherosclerotic plaque leading to thrombus formation and coronary occlusion. Question number 2. A patient with chest pain unrelieved by rest or nitroglycerin is most likely experiencing option A stable angina, option B unstable angina, option C myocardial infarction, option C Prince metals angina. Correct answer is myocardial infarction. MI pain is severe, persistent, and not relieved by rest or nitrates. Question number 3. Which ECG change is most specific for myocardial infarction? Option A U wave, option B ST segment elevation, option C PR interval prolongation, option D peaked P wave. Correct answer is ST segment elevation. ST elevation is the hallmark of acute MI, STEMI. Question number 4. The priority nursing action for a patient with suspected myocardial infarction is option A. Obtain a full history. Option B. Administer oxygen. Option C. Check BP. Option D. Start IV fluid. Correct answer is administer oxygen. Oxygen helps improve myocardial tissue perfusion in acute myocardial infarction. Question number 5. Which cardiac biomarker is most specific for myocardial damage? Option A CKMB, option B LDH, option C troponin, option D myoglobin. Correct answer is troponin. Troponin I and T are highly specific and sensitive for myocardial injury. Question number 6. The classic pain of myocardial infarction is usually described as option A sharp and stabbing, option B crushing heavy substernal, option C localized and brief, option D radiating to lower extremities. Rational. Correct answer is B crushing heavy substernal. Myocardial infarction pain is typically crushing heavy radiating to jaw or arm or neck, back. Question number 7. Which drug is given first in acute MI management? Option A heparin, option B option C digoxin, option D atropine. Correct answer is aspirin. Aspirin reduces platelet aggregation and limit clot growth. Question number 8. Thrombolytic therapy for myocardial infarction is most effective if given within option A 12 hours, option B 24 hours, option C 6 hours, option D 48 hours. Correct answer is 6 hours. Yearly thrombolysis within 6 hours improve the myocardial infarction. Question number 9. Which complication is most deadly within the first 24 hours of myocardial infarction? Option A pericarditis, option B heart failure, option C ventricular dysarrhythmias, option D cardiogenic shock. Correct answer is ventricular dysarrhythmiasis. Ventricular dysarrhythmia are the leading cause of sudden death post MI. Question number 10. Which position is best for a patient with acute MI? Option A supine, option B semifowlers, option D prone, option C Trundleberg. Correct answer is semifowler position. Semifowlers reduce preload and eases breathing. Question number 11. The MONA protocol includes option A morphine, oxygen, nitroglycerin, aspirin. Option B, metoprolol, oxygen, nitrates, atropine. Option C, magnesium, oxygen, noradrenaline, amiodarone. Option D, morphine, omeprazole, nitrofroside, adenosine. Correct answer is morphine, oxygen, nitroglycerin, aspirin. Mona is the first line emergency care for suspected MI. Question number 12. Beta blockers in MI help by option A, increasing heart rate. Option B, decreasing myocardial oxygen demand. Option C, decreasing blood pressure. Option D, dilating bronchioles. Option B is correct answer. Decreasing myocardial oxygen demand. They reduce heart rate, contractility, and oxygen consumption. Question number 13. Which of the following is a late complication of MI? Option A, cardiogenic shock. Option B, Dressler syndrome. Option C, ventricular arrhythmias. Option D, pulmonary edema. Correct answer is Dressler syndrome. Dressler syndrome occurs weeks after post-MI pericarditis. Question number 14. The, ner- the nurse should teach an MI patient to avoid. Option A, sudden exertion. Option B, light walking. Option C, stress reduction techniques. Option D, low fat diet. Correct answer is sudden exertion. Sudden exertion increase myocardial workload and risk for recurrence. Question number 15. The main dietary advice post myocardial infarction includes high sodium, low fat, low cholesterol, high saturated fat, high sugar diet. Reducing cholesterol and fat lowers risk of further cardiac events. Correct answer is low fat, low cholesterol. We are move on SATA questions. Select all that apply. Which common symptoms of MI? Chest pain, SOB, diaphoresis, fever, nausea, vomiting. Choose the answers. MI patient having chest pain, SOB, oversweating, feeling nausea and vomiting. MI's classic signs include pain, shortness of breath, sweating, nausea. Question number 17. Risk factor for MI include smoking, hypertension, diabetes, hypothyroidism, high cholesterol. Correct answer, smoking, hypertension, diabetes, high cholesterol. Smoking, hypertension, diabetes, hyperlipidemia increase MI risk. Question number 18. Nursing priority in acute MI. Oxygen therapy, pain therapy, continuous ECG monitoring, encouraging exercise immediately, reassurance and emotional support. Stabilizing and reassurance as essential, not for the encouraging exercise immediately. All other correct. Question number 19. Which drug may be prescribed post-MI? Beta blockers, ACE inhibitors, statins, calcium supplements, antiplatelets. Except calcium supplements, all other drugs, beta blockers, ACE inhibitors, statins, antiplatelets to reduce the recurrence. Question number 20. Complication of MI include heart failure, arrhythmiasis, cardiogenic shock, stroke, gastritis. Correct answer, heart failure, arrhythmiasis, cardiogenic shock, stroke, except gastritis. MI can lead to multi-organ complication but not gastritis. Well done, nurses. You have just completed 20 myocardial infarction questions with rationals. Remember, practice makes progress, and even every question brings you closer to success in NCLEX and clinical practice. Don't forget to like, share, and subscribe the Rising Nurses Next Generation Nurses for more nursing quizzes, lessons, and tips. Until next time, keep learning, keep rising.